Welcome back to another MedRevisions video. Today we'll discuss a May 2021 recall and also give you some helpful tips for the upcoming exams. And hopefully that will bring you one step closer to passing the PLAB 1 exam. So let's dive right into the video. Before we discuss the question, take 50 seconds to pause the video and comment the answer down below. Okay, so now that you've had time to read the question and answer it, let's get to the question. We have a 48-year-old woman who presents with muscle weakness and fatigue. Her past medical history includes a Colles fracture and renal colic. Routine blood test has been undertaken. Her blood results are as followed. Her hemoglobin levels are 148, platelets 245, WBCs 7, PTH 30, calcium corrected levels 3.2, ALP 50, sodium 138, potassium 4. What is the most appropriate treatment? Right, so the correct answer here is parathyroidectomy. So before we discuss the answer and the other options, don't forget to smash that like button. And also comment down below on any other topics you'd like us to cover in the future. Make sure to check out our reviews from the past PLAB 1 candidates. The link is in the description below. So we have some exciting news for you. Go check out our new update where we have our new study notes which you can study before you attempt the questions. And we also have our revision notes, which is the added new feature where you get the highlighted parts and the key points to make it easy for you to do your revision. And the other thing is, once you are done with the notes, you can attempt those particular questions that come under those notes separately, any section you like. So do check it out. So as I said before, the correct answer is parathyroidectomy. Now let's see why. So we can see that from the blood results that this patient is suffering from hyperparathyroidism. Her calcium levels are elevated and so is her parathyroid hormone levels. But the rest of the results are normal. And so at this patient's age and given her past medical history, a parathyroidectomy is the best answer. A surgery is advised for symptomatic patients under 50 years with elevated calcium levels and creatinine clearance of less than 60 milliliters per minute. Alright, so why not cinacalcet? Cinacalcet reduces serum calcium and PTH levels. It elevates serum phosphate but does not reduce bone turnover or improve bone mineral density. So that is not the correct answer. Raloxifene. Now raloxifene and HRT or hormone replacement therapy may be used in postmenopausal women, and they should not be used purely to treat primary hyperparathyroidism because of the risks associated with estrogen replacement. Okay, and lastly, calcium carbonate is not appropriate here for all the reasons that have been discussed in the other options, and giving calcium carbonate would do the opposite, which is not what we need here. Okay, so once again, parathyroidectomy is the correct answer, and I hope all of you got that right and the explanation was clear for all of you. So we have lots of questions on this topic on our MedRevisions platform. Make sure to check it out, and we also have other topics covered that are high yield as well as some rare questions, so head on to our platform and check it out. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.